Mr. Abubakar, who has come to our hospital from Nigeria. Mr. Abubakar came to us because of a persistent, long-standing left hip problem. He was suffering severe pain on normal activities. His mobility was severely restricted, and he, on the X-rays, was found to have a severe osteoarthritis of the hip. This is a condition in which the hip joint gets damaged, leading to restriction of activity, restriction of function, and it causes severe discomfort and pain even in normal activities. Mr. Abubakar has undergone a total hip replacement, from which he has achieved an excellent recovery. He is now on his 5th post-surgical day and is about to be discharged from the hospital. Total hip replacement is a very, very common procedure performed worldwide to treat this particular problem. It has wonderful results and it allows patient to recover from their pain, improve their function, and in some patients even allow them to participate in sports activities. So I hope Mr. Abubakar would be able to tell you about his experience, how he went through surgery, and how was his experience in coming to India and getting his treatment done.
My name is Abubakar. I'm from Kaduna State, Nigeria. I started having problem on my left hip. I was experiencing pain. That was in May 2009 when I was studying in the United Kingdom. So I went to my general practitioner in the hospital, who gave me some pain medications. After the pain medication, the condition didn't improve, so he referred me to a physiotherapist. Still, there was no improvement after undergoing the physiotherapy. So when I went back to Nigeria, I met with my doctor, who ordered for an X-ray of my left hip. Now, after the X-ray, he told me that my hip is damaged, my left hip is damaged. And I was not happy that time, but he gave me two options, either to continue on medication with the pains and then or undergo surgery. Now, I looked at those two options. If I continue with the medication, it will be for a very long period of time because already my bones are damaged. So I opted for the second option. Now for the second option, I started looking for people that had similar experiences. I have a friend who had undergone a surgery in Nigeria, but it was not successful. And I had another friend who also underwent a surgery in Egypt, and it was successful. So I opted for the surgery in Egypt because I want my surgery to also be successful. He gave me all the details. I contacted the orthopedic surgeon. Unfortunately, there was communication gap. If I phone him, he will not reply back, and I was not sure of the outcome of my surgery. Even though the cost was about $1,000, but I felt that the quality may be compromised. So I looked for another option that was in the United Kingdom. I sent my X-ray through email, and he also told me the same thing, that my left bone was damaged and it has to be replaced through surgery. The process was faster than in Egypt, but the cost, it was 3 times or more than what was available in Egypt. And the waiting period, if I send my mail, it takes time before they respond, and I was in pain, so I cannot be able to continue waiting because delay is also causing a lot of damage in my heart. And then I was informed about Columbia Asian Hospital, and I emailed them. Immediately I emailed them. Within 24 hours, I received back a response, and then they told me to send my X-ray. I sent my X-ray. Within 24 hours, my case was referred to Dr. Jayant Arora, who also told me that I have to undergo a surgery. The whole exercise took about less than a week. I knew my stand. They sent a lot of information and leaflets on my condition to me, and the price was cheaper than the price in Egypt and the United Kingdom. And then I have to do a literature review of the hospital because I do not know the hospital very well. So I have to look at certain things that will make me take a decision. So I look at the CV of the doctor that is going to do my surgery. I learned that he had the necessary qualifications, and he had variety of experiences, including United Kingdom. I saw that he has worked in Aberdeen, in Glasgow, in many places in the United Kingdom. So they sent my visa application. I went to my embassy in Abuja, Nigeria. It took me less than 3 days to get the visa at a cost less than $100, which is very cheap compared to other places I have also gone. So I booked an appointment with them to come for the surgery between 12th to 19th of May 2011. So I boarded my airplane to Ethiopia, then to Delhi. I arrived on 3rd May 2011, and I was immediately admitted to the hospital. On that day, all my specimens were taken, including X-ray, and analyzed, and I was fit for the surgery. The next day, I underwent the surgery. I was taken to the theater, and it took about 3 hours for the surgery. And surprisingly, it was a painless surgery. I couldn't feel any pain during the surgery when I was in the theater because I was given an anesthetic in my spine, and the whole process was excellent to me. And then after the surgery, there was a little pain, and to my surprise again, the pain was controlled and was managed. And as I am talking to you now, my damaged hip have been removed, and I am now having an artificial hip. And there was a small incision that was made in my left thigh, and that was where the surgeon removed the damaged hip, and it was replaced by an artificial hip. If I didn't tell you now, you will not know that I'm having an artificial hip. Now, this is the 5th day I am spending in the hospital. Within those periods, I have been given pain relievers. The dietitian on a daily basis, about once or twice, comes to me and advises me on the diet I'm going to take. I also I'm still undergoing physiotherapy. And right now, I can walk using an aid. I have been walking on the 3rd day, on the 4th day, and today is the 5th day, and have been walking. And I have been told to continue the exercise until about 6 weeks when I will not use any walking aid. So I can say that it is a very good experience I have in this hospital. The staff are always ready to assist me. Immediately I ring a bell, they will rush within in less than a minute and attend to me. I am served with any type of meal I want. They have international dishes. I am just feeling like I'm at home in the hospital. Right now, I do not have any, the limping I am doing. I was limping before I come to the hospital because my left leg was shorter than the right leg because the bones were destroyed. But right now, the 2 legs are on the same level. And the pain I came with now, I do not experience that pain right now. And what I'm waiting for now is for me to be physically fit to throw away my walking aid and continue my